My name is Lorena Castle. Today's date is May 27, 2023. My final presentation will be on Gaucher disease. Gaucher disease is an autosomal recessive inherited disorder of metabolism where a type of fat called glucocerebrosidase cannot adequately degrade it. Normally, the body makes an enzyme called glucocerebrosidase that breaks down and recycles glucocerebrosidase, a normal part of the cell membrane. People who have Gaucher disease do not make enough glucocerebrosidase. This causes the specific lipid to build up in the liver, spleen, bone marrow, and nervous system, interfering with normal functioning. This disease is a result of a buildup of certain fatty substances in certain organs, particularly your spleen and liver. This causes these organs to enlarge and they can affect their function. The fatty substances also build up in the bone tissue, weakening the bone and increasing the risk of fractures. If the bone marrow is affected, it can interfere with your blood's ability to clot. The enzymes that are damaged by this disease are lysosomes, an enzyme that breaks down these fatty substances and doesn't work properly in people with Gaucher disease. The function of the cell that is impacted by this disease is breaking down fatty substances. The impact of this disease on the organs is that the spleen and the liver may get very large and stop working normally. Lipids start to build up in these organs and stop them from working properly. Gaucher disease also affects the lungs, eyes, brains, and bones. Functions of the body that are impacted by this disease are delayed growth, delayed puberty, weak bones, bone pain, brain damage, joint pain, trouble walking or getting around, not having enough healthy red blood cells, which is anemia, and also extreme tiredness, which is also known as fatigue. The symptoms and physical findings associated with Gaucher disease vary greatly from patient to patient. Some individuals develop few or no symptoms. Others may have serious complications.
Oh, you said you was going to test?
You should get tested if you experience symptoms of Gaucher disease or if it runs in your family. Even if you do not have Gaucher disease, it may be helpful to know if you are a carrier. If one of your children has been diagnosed with Gaucher disease, you should also have your other children tested. It's important for those at risk to get tested even if they do not have symptoms, since the disease can cause permanent damage if left untreated. You may also want to inform other family members, such as your siblings, about the diagnosis. Gaucher disease is an inherited disorder that affects many of the body's organs and tissues. There are 3 types of Gaucher disease. Type 1 Gaucher disease is the most common form of this condition. Type 1 is also called non-neuropathic. Gaucher disease is a brain and spinal cord, which is usually not affected by the nervous system. These features of this condition range from mild to severe and may appear anytime from childhood to adult. Type 2 and Type 3 Gaucher disease are both neuronopathic forms of the disorder because they are characterized by problems that affects the central nervous system. Type 2 can be life-threatening medical problems in infancy. Type 3 is life-threatening medical problems but tends to worsen more slowly than Type 2. In addition to being more worse than Type 2, it can also cause abnormal eye movements, seizures, and brain damage. Gaucher disease is an autosomal recessive disorder. That means a person must receive the Gaucher gene from both parents in order to have the disease. Most genes exist in pairs, with one coming from the mother and the other coming from the father. When one Gaucher gene in the pair is abnormal, the child is an asymptomatic carrier who can pass that abnormal gene to his or her children. When both genes in the pair are defective, a person will have Gaucher disease. If your partner does not have the Gaucher gene, each of your children will be carriers. If your partner is a carrier of the Gaucher gene, each child will have a 50% chance of having the Gaucher disease and a 50% chance of being a carrier. If your partner also has Gaucher disease, each of your children will have Gaucher disease. The diagnosis of Gaucher disease is based on clinical symptoms and laboratory testing. A diagnosis of Gaucher disease is suspected in individuals who have bone problems, enlarged liver and spleen, changes in red blood cell levels, easy bleeding and bruising from low platelets, or signs of nervous system problems. Laboratory testing involves a blood test to measure the activity level of the enzymes. Individuals who have Gaucher disease have a very low level of this enzyme activity. A second type of laboratory testing involves DNA analysis of the GBA gene. Both these enzymes and DNA testing can be done. A bone marrow or liver biopsy is not necessary to establish the diagnosis. The available treatments to counteract the damage are medications, physical therapy, enzyme replacement therapy, bone density screening, bone marrow transplant, surgery to remove the spleen, joint replacement surgery, and blood transfusions. People with Gaucher disease need enzyme replacement therapy regularly. It's almost about every 2 weeks for treatment to be effective. Your provider gives you an enzyme infusion in your arm. You may receive infusions at an infusion center. They can also be given in your home. During the enzyme replacement therapy, the enzyme is delivered directly into your bloodstream from where it can reach your organs and bones to break down fatty chemicals so they can't build up. Now, the substrate reduction therapy is a treatment that decreases the fatty chemicals so they can't build up in your body. You can take substrate reduction therapy medication by mouth. You must continue taking the medication regularly to prevent damage to your body. But you need to also ask your provider which therapy would be right for you. People with Gaucher disease, their spouses and friends may face a wide variety of emotional and social challenges in addition to the physical limitations or complications posed directly by the disease. At different times, the effects of Gaucher disease can impair mobility for some people. Walking can become tiresome and difficult, especially for long distances or up and down stairs. A decrease in mobility may occur as a result to a bone crisis or as a result of a bone fracture. The use of ambulatory aids such as wheelchair, crutches, cane, or a walker may be helpful in these situations. People with Gaucher disease also experience liver and spleen enlargement, which can affect a person's appetite because of the pressure exerted on the stomach. People with Gaucher disease often report a sensation of feeling full, even after having only a few bites of food. The enlarged organs leave little room in the body cavity for a full stomach. People with Gaucher disease may take longer to eat because their stomachs are because their stomachs fill up so quickly. The body image can also be affected. It can be difficult challenges for people with Gaucher disease who suffer from the full spleen enlargement, liver enlargement. Children and adults may be tested to see if their spleen and liver has been enlarged. Oftentimes, children and adults can be ridiculed or accused of being fat, looking pregnant, or otherwise just being different. People can become very conscious of their appearance, and so treatment may be very unpleasant and can hurt their self-image. Since there is no cure for Gaucher disease, the doctor will likely recommend routine monitoring to watch for disease progression and complications. The frequency of monitoring will depend on the situation. A doctor may refer a patient to a specialist, like a hematologist or a geneticist. Physicians may also offer support groups for patients to talk to people that have Gaucher disease or someone who has a child with the disease. Overall, with regular therapy, Gaucher disease type 1 is treatable. Treatments either increase enzyme levels or decrease the fatty substances that build up in the body in Gaucher disease. There is no treatment for the neurological damage from Gaucher disease types 2 and 3. Here are my references that I use to do all my research on Gaucher disease. Thank you.